For more on all of that, let's bring in Infectious Disease Specialist Dr. Matthew Oughton. And Dr. Oughton, thank you very much for joining us this afternoon.
Always.
So right off the bat, let me ask you about this new contact tracing strategy, this app, this COVID alert. What do you think of it?
I think I guess my reaction to it is mixed. On the one hand, as was just detailed in that press conference, I think this technology can be an indispensable add-on to what we're already doing. If you look at the population of Canada, I'm not so worried for people in small town settings when it comes to contact tracing. I grew up in a very small town, and it's pretty easy to say, "Oh yes, I was a week ago at that party at the town hall, and Joe and Mary and Bob were all there." You know exactly who was there. But in large urban centers, obviously, you go to something like a shopping mall, you have no way of knowing all the people who were there. So it greatly increases the ability of public health to target and know, identify contacts that otherwise might go unidentified. And when you're trying to control a disease that can spread as readily as COVID-19 does, that's, I think, a huge advantage. The downside is that by having it be a voluntary app, of course, you're relying, as was pointed out, on people signing up for it. And it's not going to be very effective if very few people sign up for it. But I think they've done a good job of building in the privacy safeguards to protect people's anonymity while still making this a useful tool.
Yeah, they certainly went out of their way to make sure that people were informed that all of these privacy measures were in place, that that they would be anonymous, essentially. The Prime Minister also saying that in his news conference this morning. But still, people are going to be concerned about that because things go wrong in technology. Things happen. There are breaches all the time. And that may pull back on the efficacy of this because a lot of people may not want to sign up.
I think you're quite correct. I think there may be a lot of concern about that, and I suspect there's going to have to be a lot of communication, a lot of marketing to try to convince people that this really is safe. I mean, you can look at this as a balancing of risks. If you sign up for this app, you do it understanding that there's at least a perceived risk of problems around confidentiality. Then again, if you don't sign up for this app, then you incur some increased risk of being exposed to people who you don't know had COVID-19. So people have to decide, I guess, which risk they're more comfortable with.